If you've experienced unrelenting physical and mental tiredness that doesn't improve with rest, you may be experiencing fatigue as a person with Parkinson's disease. In today's video, we're going to be discussing the difference between fatigue and sleepiness, how common fatigue is in Parkinson's disease. Also, we're going to discuss treatment options and ways to cope with fatigue as a person with Parkinson's disease. Without further ado, let's get rolling. Welcome to the Parkinson's Disease Education Show. Hit it. Well, hello again to everybody watching and listening. As I said, we're going to be discussing fatigue and Parkinson's disease, and we're going to be jumping right into it. So first, I want to talk a little bit about the difference between fatigue and sleepiness. But first, I'm going to have you move just a little bit closer. I want you to come in for this. Good. A little bit closer. Okay, perfect. Just a little bit closer. Too close, too close. Whew, that's better. Okay. No reason to get too personal here. Okay, so back to the topic, fatigue and sleepiness. So first of all, fatigue is, as I mentioned in the preview, an unrelenting tiredness, and it's experienced as a physical and or mental tiredness. It's basically a deep tiredness or exhaustion that just doesn't get better, even when resting. As opposed to sleepiness, which is the feeling of wanting to fall asleep, or essentially, if you closed your eyes, you could just drift right off. But fatigue doesn't always improve after sleeping, even though sleep can help in some ways. We'll talk about that a little bit later. But I want to say that up front because a lot of times people will interchange those terms, and that's absolutely not correct. Sleepiness and fatigue are two different things. As a matter of fact, there are entire conditions that we've discussed in other videos in the past, such as excessive daytime sleepiness, that are distinct non-motor symptoms from fatigue. So just to avoid some confusion on those terms. Okay, so how common is fatigue? It happens in about 50% of those living with Parkinson's disease. And of those 50%, 1/3 of those folks say it's their most debilitating non-motor symptom of Parkinson's. So what stages of Parkinson's, or I guess what part of the course of PD does it occur? Essentially, it can happen at any time. It could be early on in the diagnosis, it could be after a prolonged period of time. There's no rhyme or reason as to exactly when it can occur. In addition, it can happen regardless of how severe or how mild the movement symptoms are. So you could have hardly any tremors, maybe just a little bit of slower movements, shuffling gait, things like that, and just mild symptoms, and you can still have a lot of fatigue. Conversely, you can have a lot of dystonia, tremors, and a lot of rigidity, and not have as much fatigue as some other people. Fatigue can also be associated with off times, which kind of makes sense because with the dopaminergic changes that happen with Parkinson's disease, your energy levels can fluctuate. I'll say it before if I haven't said it already. If I haven't said it already, I'll say it again. Fatigue can be debilitating for folks with Parkinson's disease. I've heard of this from folks anecdotally. I've also seen it firsthand. On its face, there may be some specific things that you can do that are related to other Parkinson's non-motor symptoms, that if you could improve those things, you could improve fatigue. For example, if you've experienced depression, whether before diagnosis or during diagnosis of Parkinson's disease, helping manage depression could reduce the symptoms of fatigue. In addition to that, chronic pain, as well as managing sleep issues, could really help with fatigue as well. Medication management is really important as well. Your neurologist, hopefully a movement disorder specialist if you're able to see one, can help you adjust Parkinson's medication doses as well as other medications you may be taking to manage Parkinson's to help those fatigue levels. A lot of times fatigue can come as a side effect of some medications. Your primary care physician may need to get involved to help you manage symptoms or side effects of medications you're taking for other non-Parkinson's conditions. And finally, ruling out other physiological causes of fatigue is really crucial before you even address the others, in my opinion, because you could have issues like hypothyroidism or low thyroid, you could have iron deficiency, anemia, you could have vitamin deficiencies. There are all kind of things, a plethora of issues that could cause fatigue that's physiological that could be treated. If that's the case, you're going to knock it out of the park. So that's what you can do with the help of others. What can you do on your own? Some tips with coping with fatigue that I found that make complete sense are, first of all, to stay hydrated. I've covered that in a video in the past about how important it is in Parkinson's disease to stay hydrated. It can even impact the level at which you absorb medications you're taking to help with Parkinson's. I'm going to link that video up here. Be sure to watch that if you haven't already. In addition to that, just keeping your regular diet going, making sure that you are eating regularly. Sometimes with Parkinson's you don't feel as hungry, or you may feel full early, but just try to at least have smaller meals. If you don't want 3 large meals in a day, try to keep a regular balanced diet as much as you can so that you're getting the calories that you need for your metabolism to be up. The other thing with meals is to make sure you're watching your meal times in coordination with when you're taking carbidopa, levodopa. That's really important to be able to maximize absorption of your meds. Adequate sleep hygiene is also really important. If sleep disturbance is an issue for you with your Parkinson's disease, you have to learn about self-help with sleep hygiene. I'm going to link another video that I did in the past on 5 tips to help with sleep hygiene that you can start to try right away. Short naps could be helpful, no more than 30 to maybe 60 minutes max on the naps. Even a little bit of rest during the day could help you to recuperate some from that fatigue, even though it's not really a guarantee. From the social aspect, do not isolate. Isolating yourself is going to put you in a negative spiral. You're going to become more and more depressed. The fatigue is probably going to become worse as well. So try to be social, have a friend over for coffee or tea, go out to eat with a friend for lunch, go to your Parkinson's support group meetings. Do as much as you can to be socially active, and that will also help to keep you from becoming more and more sedentary as well. The other thing is you want to plan your day in smaller chunks. If you have a house project to do, don't do it all at once. You can vacuum one room. You can do a project in 2 or 3 different bouts instead of one sitting. Even physical or social activities should be planned in the same fashion. Do it in short bouts so that you can pace yourself. And if you're doing any kind of physical project, just take breaks. There's no sense in being a hero. Take it into account. You can still do a lot, but you may have to do it in small chunks. And finally, this is the most important point of all, in my opinion: exercise. Obviously, I'm biased as a doctor of physical therapy, but exercise can do wonders for fatigue. And the thing about exercise is it's not just about the physical aspect of strength or balance, that kind of thing. Exercise is also crucial for your mental health, for your cognitive health, and just for your overall physiological well-being. The number one barrier to exercise with those with fatigue is often that they have so much fatigue that they can't even really get started with exercise. Or with the little exercise they're able to do on their own, they become so fatigued afterwards, they really are just done for the rest of the day. This is where an expert really is important. If you're trying to watch videos online, if you're trying to look up exercises to do for Parkinson's, whatever, you may not succeed as much as you would working with somebody like a doctor of physical therapy, occupational therapist, or so forth, to help tailor those exercises to you individually and your level of fatigue. A physical therapist is an expert at prescribing exercise, or at least they should be. And so when working with Parkinson's disease, obviously there are going to be individuals that can't tolerate as much intensity of exercise as other folks. I'll give you an example. Let's say in the LSVT Big program. The LSVT Big as a therapy protocol is 4 times a week for a month. So 16 therapy sessions, and they're an hour each. There are many folks that can't tolerate the full repetitions on the exercises. The way that the exercises are designed, you do 8 repetitions of each. There are some rocking exercises that are multi-directional repetitive, rocking forward and sideways rock and reach. Those are 10 to 20 repetitions. When we first start with some people, they can't tolerate 8 repetitions of these exercises. By the time they get to the second or third exercise, they're just exhausted. So we might start with 3 or 4 repetitions and work our way up. With whatever exercise regimen you might be doing, whether it's LSVT big or something similar, you don't have to do all the exercises in one big session. You could break it up into 2 to 3 exercises max for about 5 to 10 minutes, and then do another session with different exercises later in the day, or as many sessions as you need to get that full program in during the day. That goes back into breaking things up into small chunks. You can accomplish an entire protocol or an entire home improvement project, but you don't have to do it all in one session or all in one day even. But again, going back to expertise, that's where somebody like myself or another therapist who specializes in Parkinson's disease can really help you, because not just anybody is going to know how to prescribe exercise for you at your specific level of fatigue. They could actually gauge that a little bit better than individually working with somebody than just going off of a generic recommendation. And by the way, just a quick plug for our memberships. If you're a Parkinson's Warrior level member of the channel, you get to have individual consultation with an expert like myself at a discounted rate that you're not going to get anywhere else. Well, no more about that. That's going to conclude today's episode on fatigue and Parkinson's disease. If you're listening to this on audio, there will be a video version available on YouTube, and the link will be in the description. As I mentioned channel memberships earlier, there is a link in the description to join the channel or to just explore memberships and what the perks are that are offered. Thanks so much in advance for your consideration on that, as every penny helps to continue to bring this great material to you. It's completely optional, but every little bit helps. So I appreciate you very much. With that, I'm going to sign off. As always, be empowered. Catch you in the next video.